Guys, it's been about a month since my last video. I just wanted to give an update about how my lipedema tissue removal surgeries went. I had brachioplasty on my arms and I had a fleur-de-lis FDL tummy tuck on my abdomen. So what I'm going to talk about in this video is a little bit of the things I did to prepare for surgery and how those first couple weeks after surgery went. So I had my surgeries, both of them together. They said it was about 8 hours total, which is a long time. Actually did really well with the anesthesia. It was just, they kind of laid you down and they talked to you in the operating room, and next thing you know, I was awake and they were bandaging me up and they said it was all done. And then I came home. They bandaged my full arm, so I couldn't move it. I had to do the T-Rex arms for about 4 days until my follow-up, where they took off the bandages. The surgery went well. I didn't have any complications. When they took off the full ACE bandages at my follow-up, which was 4 days after, my husband was with me, and it was very emotional to see what my arms look like after surgery. So I'll show a video here. That's just kind of how my arm looked and how it jiggled after surgery, and this is what it looks like after my brachioplasty. So as you can see, I don't have that jiggle. I mean, there's like a little jiggle because it's normal, but I mean, the difference is night and day. I've had some swelling. I do wear my compression. I just took it off for this video so you can kind of get a feel of how everything looks. The swelling has been mostly confined to my forearms, which is, I don't know if you can kind of see that. It's still swollen. I'm only 4 weeks out, so it's a little swollen. The scarring has been great. I haven't had any openings. I've been cleared to do scar massage, so I use the silicone gel, and I actually use like a mixture of coconut oil and castor oil to massage my scars. But if you want to take a peek, see if I can get a better view. There we go. So I think the scars are coming along great. My surgeon placed them in a spot to where you can't really see them if my arm is down or to the side. My vertical and horizontal incisions on my FDL is looking great too. I haven't had any openings. I've been wearing compression with that, especially during work. I actually did go back to work 2 weeks after surgery only because I was doing really well, and the type of work that I do isn't really strenuous. I'm a home infusion nurse, so I just hook my patient up and then monitor them for the duration of the infusion. I'm not doing any heavy bedside nursing or anything. In terms of pain, I actually haven't had much pain. It just feels tight. It feels tight. The first week was rough only because I really lacked mobility in my arms and abs. Sometimes if you get your tummy tuck surgery, you rely on your arms a lot. Or if you get your arms done separately, you rely on your core to lift you up a lot, but I couldn't really do that. So I had to rely on my husband a lot to help me up, to get out of the recliner. So these are my biggest tips for prepping yourself for surgery. The first tip, put your body in a state of healing. So for me, that meant quitting sugar completely for 2 months before surgery. In fact, with lipedema, we should be following an anti-inflammatory diet as is. And sugar for me is the biggest inflammatory food I can have. So I knew eliminating that before surgery was just going to kind of help things, heal quicker. Hydrate for the weeks leading up to surgery, because you're going to be swelling so much and you want your body to be able to process all that trauma that you've just put your body through. If you can, work out and lift weights before surgery. I did not work out my arms as much as I should have. However, that being said, in about a few months, I will be cleared to work out my arms, and I'm just ecstatic about doing that because I feel like the first time I'm actually going to be able to see the work that I put into my arms. You know, I can see the muscle now because of all that lipedema tissue that's no longer there, which is fantastic. Some of the items that I really recommend for these surgeries is, of course, compression. I'm not a slave to compression. I wear it during work. I like to give myself a little breather when I get home, so I'll take it off. I don't sleep in it, but for most of the day at work, I am wearing compression. You want to make sure you have comfortable sleeping arrangements. I thought I can get away with sleeping on my bed with pillows and a wedge pillow. I actually bought like a pregnancy pillow. It was so painful. That first night, I remember trying to get out of the bed in the middle of the night to go to the bathroom, and it was incredibly painful. So my brother offered to bring over a recliner, and I slept in the recliner for about 2 weeks, which worked out great. So if you could get a recliner, if I didn't have my brother bringing it over, I did look on like Facebook Marketplace and found some cheap ones that I was going to buy. So I would highly recommend doing something like that. Supplements that I've been taking electrolytes. The one that I bought is a lower sodium electrolyte just because I know I'm trying to get rid of some of the swelling that my body has. Arnica for the bruising that I had, and I took some other, magnesium. High dose vitamin C has been great because the last thing you want to do is get sick before or after your surgeries. It is beyond painful to cough or sneeze after your surgery. And last thing you want to do is pick up a virus when you're trying to heal this. So I highly recommend high dose vitamin C for a few weeks before, and I'm still taking it a month. Sticking to an anti-inflammatory diet during the healing process has also been fabulous. There was one day where I cheated. I was home by myself. My husband had to go back to work, and I was so hungry, so I ordered a pizza. I immediately swelled from the amount of sodium. My forearms looked like Popeye because of all the water I was retaining. So if you can, stick to an anti-inflammatory diet after surgery. Something else that helped me was walking. I know it's very difficult in the first couple weeks because you're hunched over, your arms are in the T-Rex position. It is very difficult to walk, but it needs to be done. You don't want to get blood clots. You want to make sure that you're moving your lymphatic system, that you're getting some of that water moving through your body. So walking, I did light walks in front of my house. I tried to do just light walks around the house, taking it very easy because your body's still, going through that trauma. Since I'm 4 weeks out now, I'm going to start trying to incorporating a little bit more gentle exercises. We have an exercise bike, so I'm going to try to start incorporating that this coming week. Just, very easy. My doctor did clear me to get my heart rate up, which is fantastic. I cannot wait. So I'll be starting that. How I'm feeling. So this is what I thought I was going to struggle with a lot, was the aftermath and just not recognizing myself. But I cannot stress how excited I am about this surgery. Every time I look in the mirror, I'm just filled with so much joy. I feel like this is how I'm supposed to look. Like, getting that tissue off of my arms was huge. Getting the tissue off of my abdomen was huge. So when I look in the mirror, I thought I was going to struggle with it. Like, I don't recognize that person, but to me, I do recognize her. I recognize that this is how I'm supposed to look. I had a date night with my husband a couple days ago. I got a new dress that I would never have purchased before just because of the design. It's kind of a ruched V-neck, or not V-neck, like a V waist. And, you know, before that, I just kind of emphasized the tissue that I had there. But I was able to wear it and feel really good in my skin. So mentally, I've been doing really, really well. I'm just excited to get in the gym and start building up that muscle. So what's coming up next for me, I know I mentioned in my first video that I was gonna start from top to bottom. I'm gonna hit the gym, go hard in the gym, and then probably next year, I'm gonna get my calf surgery for the lipedema tissue to be removed from the lower portions of my leg. I don't know where I'm going yet. I have a couple surgeons that I'm going to schedule consultations with and determine, you know, who I want to do it through. So that's what's next. Again, I'm going to try to hit the gym hard, build as much muscle before I have these surgeries, and, you know, just really put my body in a great place. I'm still continuing with all the conservative measures that I've done in the past. That includes, you know, dry brushing, vibration plates, anti-inflammatory diet, no sugar, hydration, walking, manual lymphatic drainage massages that I'm getting done through, you know, a masseuse and through myself. Like, I'm able to perform them on myself. So that's what's coming up next. So I'm just going to show a little bit of the, you know, before and afters right now, and I will see you on my next video. Thanks.